We talked for a while, but I just couldn't figure out what he needed.
I wouldn't have made the same choice with my healthcare. I made a recommendation, but she said her culture was clear about what she had to do.
Working through a translator is a challenge. I have to try hard to look at the patient instead of the interpreter.
We are told to ask patients if they served in the military, but what do I do if the answer is yes?
Medical staff interact with patients every day in practices, clinics, and hospitals, and should try to be aware of the wide array of cultures patients identify with. Culture can be anything. Some people feel a strong connection with their racial, ethnic, or religious backgrounds. Others consider themselves part of communities that share similar experiences. Some might identify with people who have physical disabilities or mental health conditions. Others associate with sexual orientation, gender status, age, or region of the country. Finally, some people connect to past experiences or shared values, such as military experience, political beliefs, or type of education. Any of these cultural backgrounds can influence a person's experience with healthcare. As a medical provider, you do not have to have first-hand experience or knowledge about a particular culture to provide compassionate and empathetic care. Keep a few things in mind. People will explain their culture. People value their histories, beliefs, and backgrounds, and their cultures matter to them. Healthcare providers can feel confident about asking patients to tell them more about cultural influences. This information helps to inform important parts of their care. Most people are not only happy to talk about their culture, but it makes them feel respected. Culture might be the answer. Despite the extensive experience of a clinician or medical staff member, communication can be difficult. Sometimes patients' actions can be confusing, especially when things get contentious. In situations like these, the difference between the patient's culture and your culture can make the situation more difficult. Before jumping to a judgment or conclusion, consider that the patient may be acting from long-standing or important cultural beliefs. This might help you to see a difficult or frustrating interaction from a new perspective. Culture affects people's beliefs about healthcare. As you navigate the evaluation, diagnosis, treatment, and maintenance of a patient's healthcare, consider cultural influence and impact during each step. Background, upbringing, identification, beliefs, and values all affect a person's experience before, during, and after a medical visit. Culture is an important element of the histories and beliefs your patients bring to their experiences with you. Understanding your own culture, appreciating and inquiring about your patients, and paying attention to how these things might influence a person's healthcare will help you make good decisions about treatment plans and follow-up, and it will help you provide the very best care for each individual patient. Your patients deserve nothing less.